If you're having surgery, there are a number of supplements and herbal products, etc., that you need to avoid. Let's jump right to it. First is valerian and kava. They're separate, valerian or valerian root, also kava. These two supplements in particular can have a sedative effect on their own. So mixed with anesthesia could become even more of a problem, and we don't want this. Also, both of these supplements can potentially negatively affect the liver. The next one is echinacea. A lot of people take echinacea. Speaking of the liver, echinacea can negatively affect the liver, especially when mixed with some of the anesthesia or medications, the surgical procedure that you're having done. Just the act of going through the surgery could put you at risk for that. So you want to be very careful and avoid these. And speaking of which, the categories of interactions that we typically see with supplements, etc., is blood thinning. Okay, so a number of the supplements that I mentioned are going to interfere with blood clotting or cause blood thinning, which could be a problem if you are having surgery, as I know you can imagine. Also, along those lines, can increase the risk of bleeding. Again, a problem that is very clear. Some of them can affect your blood sugars. Some of them can cause additional sedation or affect anesthesia, which of course is important to so many surgeries. And then remember, supplements, herbs, etc., can interact with other drugs that they're giving, what we call preoperatively, post-operatively, and intraoperatively. Okay, so let's keep going down our list. Okay, ginkgo biloba. This is one that we worry about the bleeding risk in particular with. Okay, and some studies have actually noted that ginkgo biloba, and some studies have shown that there has been bleeding during cataract surgery, post-op, which means post-operatively, after operation, specifically of a hip replacement, and even after dental surgery. You don't want to take anything, let me put it this way, you don't want to mess with your ability to clot or your bleeding or blood thinning. You don't want to mess with the coagulation of your blood. And many of these supplements can do this. You need to be very careful. And I should also say before we go on to the others, by the way, is that you have to talk to your doctor. As much as I wish I were your doctor, I am not. You've got to talk to your doctor. You have to let them know all the supplements that you're on. They're not going to know unless you tell them. You need to tell them because there may be particular warnings that they need you to know. In addition to the things I'm mentioning, they may have others, or they may have different guidance. But to be honest with you, if you take a look online, you talk to many doctors, I have a feeling that many of them will go along with this. Remember, supplements can interact with medication, surgery, etc., in more ways than sometimes we know. All right. Next, turmeric, ginger, garlic, ginseng. All of those can increase your risk of bleeding. Again, a no-no. We don't want this. Also, they can affect blood sugar, in particular turmeric, ginger, and garlic. So keep that in mind. Again, you don't want hyperglycemia or problematic blood sugar around surgery time, and some of these supplements could interact. You want to, and so just before I go into the next ones, your doctor is going to do a preoperative assessment, okay? You might have many doctors doing this. You might have a cardiologist, you might have a family doctor, you might have a pulmonologist, you might have multiple people weighing in on whether you can go to surgery or not. They're going to ask you for your medications that you're taking to review them, but you also need to tell them about the herbs and supplements you're taking. And very likely, you are probably going to be asked to stop those a certain amount of time before the surgery. If no one has given you guidance about this, my recommendation is that you ask. Of course, you follow the direction of your doctor, not me, but know, the purpose of this video is to know that many of these supplements cause problems. If you didn't think they did, I'm here to tell you that they can. St. John's wort can interfere with anesthesia as well. Okay, that has actually a lot of potential interactions in St. John's wort. I'll link a video here that I've done on St. John's wort. I think people don't realize how many interactions it can have. Vitamin E can increase the risk of bleeding. I'm thinking about, I need to do a video on vitamin E because it can do other things too. Fish oil can actually cause blood thinning as well. So check on that. There's plenty of things you need to be very thoughtful of. Just understand, don't run into surgery without going through all your medications, herbs, supplements, vitamins, etc. with your doctors. Guys, I hope this is helpful. I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. I do daily videos. On Facebook, please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. Guys, please make sure you follow me on TikTok, WhatsApp, Threads, LinkedIn, you name it, Dr. Jen Caudle. And please go to my website, www.drjencaudle.com, to sign up for my free weekly health newsletter. Guys, I'm Dr. Jen. Love y'all.